In the early 1980s, thousands of children with haemophilia relied on a medicine called factor VIII concentrate to stay alive. Haemophilia is a genetic condition that prevents blood from clotting normally. A cut that would stop bleeding in minutes for most people could bleed for hours, sometimes fatally. Factor VIII was the treatment. It was manufactured from pooled human blood plasma, collected from donors, processed, and sold in small glass vials to hospitals around the world. For families with haemophiliac children, it was not optional. It was the difference between a normal life and a death sentence. The company that made much of it was Qatar Biological, a division of the pharmaceutical giant Bayer, and by 1982, Bayer knew there was something wrong with the blood. In July of that year, the United States Centers for Disease Control reported that 3 haemophiliacs had developed a mysterious new disease. Epidemiologists were beginning to suspect that the disease, which would later be called AIDS, was being transmitted through blood products. The implications for haemophiliacs were immediate and terrifying. Factor VIII concentrate was manufactured by pooling plasma from thousands of individual donors into single batches. If even one donor in the pool was infected, the entire batch could be contaminated, and the donors Bayer's Qatar division was using were not low risk. They were pulling plasma from prisons, from communities with high rates of intravenous drug use, and from paid donation centers in cities with large populations of high-risk individuals. They were buying the cheapest blood they could find from the people most likely to be carrying the virus. In January 1983, Bayer's own plasma procurement manager wrote in an internal letter that there was strong evidence to suggest that AIDS was being passed to other people through blood products. That letter did not trigger a product recall. It did not trigger a switch to safer donors. It triggered nothing. In March 1983, the Centers for Disease Control formally warned that blood products appeared to be responsible for AIDS cases among haemophiliacs. By this point, the evidence was no longer speculative. Haemophiliacs who had received factor VIII were developing AIDS at rates that could not be explained by any other exposure. The blood was the source, the product was the vehicle, and the companies that made it knew. In February 1984, Bayer's Qatar division introduced a new version of factor VIII that had been heat-treated to kill the virus. Heat treatment was not a new technology. It was a known method of viral inactivation that could have been applied earlier. The safer product was released onto the American and European markets. The old product, the untreated product, the product that Bayer's own internal documents acknowledged carried a risk of contamination, was not destroyed. It was not recalled. It was shipped overseas. Internal documents obtained by the New York Times decades later revealed what happened next. Qatar continued selling the older untreated medicine for more than a year after introducing the safer version. It was sold in Latin America, it was sold in Asia, it was sold in Japan, Malaysia, Singapore, Argentina, Indonesia, Hong Kong, and Taiwan. More than 100,000 vials of untreated concentrate, worth more than $4 million, were shipped to countries where haemophiliac patients and their doctors had no idea that a safer product already existed. The reason was financial. Bayer had existing stocks of the older product that it wanted to sell through rather than write off. It had fixed price contracts in overseas markets where the untreated product was cheaper to manufacture and more profitable to sell. And it had made a calculation that the lives of haemophiliacs in Asia and Latin America were worth less than the cost of destroying inventory. That is not interpretation. That is what the documents show. In Hong Kong and Taiwan alone, at least 100 haemophiliacs contracted AIDS after receiving the older product. Many of them were children. Many of them died. Li Wei-chun, whose son died in 1996 at the age of 23 after receiving contaminated factor VIII, told the New York Times that they did not care about the lives in Asia. In Japan, the government's own health ministry did not ban unheated blood products until December 1985, despite knowing they were contaminated. By that point, over 1,400 Japanese haemophiliacs had been exposed to HIV. More than 500 were believed to have died by 2001. In Italy, 1,300 people, including nearly 150 children, died from infections linked to contaminated blood products. An Italian court ordered the health ministry to pay damages to 351 victims, ruling that the ministry had been too slow to introduce protective measures and had failed to establish proper checks on plasma-derived products. Almost 100 of the victims were already dead by the time the ruling was issued. In Canada, approximately 2,000 people were infected with HIV through contaminated blood products, and up to 60,000 were infected with hepatitis C. The Canadian Red Cross was eventually found guilty of negligence and pleaded guilty to criminal charges. In the United States, estimates for HIV infections caused by contaminated blood products range from 6,000 to 10,000 people. The overwhelming majority were haemophiliacs. Many were children. The American haemophilia community was devastated in a way that has no close parallel in modern pharmaceutical history. By the mid-1990s, approximately half of all haemophiliacs in the United States who had received factor VIII concentrate were HIV positive. Half, 4,000 of them, were already dead. The human cost of those numbers is difficult to convey in statistics. These were children who needed regular injections of factor VIII to prevent uncontrolled bleeding. Their parents brought them to clinics, trusted the medicine, trusted the company that made it, and watched their children develop a disease that at the time was a death sentence. The medicine that was supposed to keep them alive was the thing that killed them, and the company that sold it to them knew, while it was happening, that a safer version existed and was being sold to patients in wealthier markets. Bayer was not the only company involved. Alpha Therapeutic Corporation, Baxter International, and Armour Pharmaceutical were also implicated. All four companies had been manufacturing factor VIII from pooled plasma. All four had access to the same warnings from the Centers for Disease Control. All four continued selling untreated products after safer alternatives became available. But Bayer, through its Cutter division, produced the most extensive internal documentation of what it knew and when it knew it. In the mid-1990s, the four companies paid $640 million to settle lawsuits brought by American haemophiliacs. $640 million for thousands of lives. The settlements came with confidentiality agreements that kept the details out of public view for years. In 2003, the New York Times published an investigation based on internal company documents that had surfaced during the American lawsuits. The documents included internal memorandums, minutes of company marketing meetings, and telexes to foreign distributors that laid out the decision-making process in clinical detail. Sidney Wolfe, director of the Public Citizen Health Research Group, who had been investigating the pharmaceutical industry for 3 decades, called them the most incriminating internal pharmaceutical industry documents he had ever seen. Doctors and patients contacted overseas told the New York Times that they had never known these documents existed. They had never been told that a safer product was available while they were still receiving the older one. They had never been informed that the company selling them the medicine had internal evidence that it was contaminated. Bayer's public response was consistent across every jurisdiction and every decade. The company stated that it had acted responsibly, ethically, and humanely. It said that it had complied with all government regulations in force at the time. It pointed to the absence of a reliable screening test for HIV in the early 1980s as a mitigating factor, which is true as far as it goes, but does not explain why the company continued shipping untreated products after a heat-treated version was available. In 2011, Bayer quietly paid tens of millions of euros to settle additional claims from haemophiliacs in Europe. The settlement was reported in the French and Italian press. It received almost no coverage in English-language media. No American newspaper of record covered it. The largest pharmaceutical HIV settlement in more than a decade passed without a single headline in the country where the contaminated blood was collected. As of 2003, the United States Department of Justice had not investigated any corporate executive at Bayer or any of the other companies involved in the contaminated blood scandal. No one went to prison. No individual was held criminally responsible for decisions that infected thousands of people, including children, with a fatal virus, using a product that the company's own documents showed they knew was dangerous. The haemophilia community that survived was left to purchase its ongoing treatment from the same companies that had infected it. Factor VIII, concentrate. The medicine haemophiliacs need to survive continue to be manufactured and sold by Bayer and the other implicated firms. The price per person could reach as high as $360,000 per year. Many haemophiliacs who survived the HIV crisis were left in poverty, dependent on the companies that had caused their infection for the medicine that kept them alive. The documents survive. The internal letters acknowledging the risks survive. The shipping records for more than 100,000 vials of untreated concentrate sent to countries across Asia and Latin America survive. The names of the children who died survive. What does not survive is any meaningful accountability for the people who made the decisions. Bayer knew the blood was contaminated. Bayer had a safer product available. Bayer chose to sell the dangerous product to countries where it calculated the scrutiny would be lower and the profits would be higher. When the lawsuits came, Bayer paid settlements that amounted to a fraction of the revenue the contaminated products had generated. When the settlements were done, Bayer continued selling medicine to the same community it had infected. That is what the documents show. That is what the company's own records confirm. And that is what no one was ever prosecuted for. The contaminated blood scandal is one of the worst corporate crimes in modern history. It is also one of the least known. The internal documents that prove what happened were buried in lawsuit discovery files for years. The settlements were sealed behind confidentiality agreements. The overseas victims, the ones in Asia and Latin America who received the product that had already been pulled from Western markets, were the furthest from the media attention and the last to receive any compensation at all. The story was never a secret. The documents were never classified. They were simply never reported loudly enough for long enough to produce the kind of public outrage that leads to criminal prosecution. The children who died are still dead. The executives who made the decisions retired with their pensions. The company that sold the contaminated blood is still in business, still selling medicine, still one of the largest pharmaceutical corporations on earth. If you found this important, subscribe to the Midnight Vault. We open the files governments and corporations spent millions trying to keep sealed. New videos every week.